Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. I hope things stay healthy and always happy wherever you are. I am Nadirah Hasnatul Aini from Andalas University. Want to tell you about coronavirus in Indonesia. Let's start it. And now I will be covering this with 5 key points. The first one is about the coronavirus. Second, the case in Indonesia. Third, death rate. Fourth, testing rate. And fifth, closing. So what is coronavirus? Coronavirus are a family of viruses that can cause illness such as the common cold, severe acute respiratory syndrome (SARS), and Middle East respiratory syndrome (MERS). So where did the first case of the coronavirus disease originate? In 2019, a new coronavirus was identified as the cause of a disease outbreak that originated in China. And this day, cases of COVID-19 have been reported in a growing number of countries, including Indonesia. The cases in Indonesia. 2nd March, the coronavirus came to Indonesia. The COVID-19 pandemic was first confirmed to have spread to Indonesia on March 2nd in Depok, when a dance instructor and her mother were infected from a Japanese national. And this day, this virus spread in 34 provinces in Indonesia. The number of positive cases of the coronavirus is still increasing day by day. In addition, the cure and the death rate are still increasing. 21st May, Indonesia's highest COVID-19 record edition. The graph have increasing sharply on 21st May. Indonesia record almost 1,000 confirmed cases in a day. It's Indonesia's highest COVID-19 record edition. 1st June. It's 26,940 confirmed, 7,637 recovered, and 1,641 deaths. Next, let's discuss about death rates. Indonesia currently has the highest COVID-19 mortality rate in Asia. Indonesia has mortality rate in Asia between 8 and 9%, owing to its poor public health management and regional disparities within its health system. The number of funerals in Indonesia's capital have risen sharply over the past 2 months. Next, more than 1,600 deaths in 2 months. Indonesia had reported at least 24,500 coronavirus infections and more than 1,600 deaths as of May 28. The death rate is almost double the global mortality rate of 4.8% based on data from Johns Hopkins University. Next, the true death toll may be underreported. As we know, Indonesia, the world's fourth most populous country, is one of the worst hit by the coronavirus in Southeast Asia. Health experts suspect the true death toll may be underreported due to low testing rates, because it's only less than 0.1% of people have been tested for COVID-19 in Indonesia. It's only 0.1%. Next, testing rate. Indonesia, the country of 270 million people, has previously been criticized for having one of the lowest testing rates in the world. Why? Because the testing rate of about 344 tests per 1 million people. So which tests are most accurate? Rapid tests versus PCR tests. Indonesia is also doing rapid tests. Rapid tests are antibody tests which determines whether a person has developed immunity to the coronavirus. These tests, however, have a limited role in diagnosis, according to experts, as it takes the body 4 days or longer after infection to produce antibodies. Rapid tests not as reliable as the standard polymerase chain reaction, or we can call it PCR tests, are used only to help with early screening of people who may have contracted the virus. Last but not least, to closing my presentation, I would like to quickly summarize the main points. Indonesia currently has the highest COVID-19 mortality rate in Asia and country with low testing rates. So, to decrease the mortality rate and to reduce the risk of infection, we should keep ourselves healthy and avoid crowded places and large gatherings of people. And that brings us to the end. I would like to thank you for your time and attention. Hope this pandemic will be over soon. Thank you.